Well, let's further explore Nigeria's response to COVID-19. We're joined by Mr. Biodu Oguni, who is a head infection prevention and control at the NCDC. Well, Mr. Oguni, thank you for joining us on the program. He joins us live from our Abuja studio, by the way. Well, we're approaching the festive season, and it goes without saying that people will travel from within and outside the country just to celebrate and spend time with family and loved ones. First, let me ask you, does the NCDC have any worries as the days approach?
Yeah, thank you very much, Coyote. It's nice to be here again. For us at the Nigeria Center for Disease Control, it's not about worry. It's about the need to intensify efforts, just as we've been doing, especially given the recent information released by the World Health Organization some days back, having declared Europe has a new epicenter for COVID-19, given the increase in the number of cases they have reported. And what does this suggest to us? We do say that the viruses don't move, people move them. And so as there will be increased travels, especially in this festive season, we anticipate that there will be a lot of movement. And that is why it's important for us to come back again to talk to Nigerians, as we have been doing. The need for them to also play their part in taking responsibility for their actions and ensuring that they help mitigate this outbreak as much as possible. Of course, we continue to work with the Federal Ministry of Health through the Presidential Steering Committee and other collaborators and partners to see how we can mitigate whatever the likely surge that may be anticipated. We know, for instance, the effects of the Delta variant that has had on the country, even other parts of the world. And this is just to let us understand that even though we have had a reduction in the number of cases that has been gradual increase, it is important to state that reduction does not mean no case again. And it only takes one case to begin the outbreak again. And so cases being still reported, and I'm glad we still see a lot of information being provided by channels and other media stations telling us that we still have cases being reported. And so with every case being reported, it's to tell us that there's potential for spread even through that case. Especially as people travel, we encourage as much as possible that people should follow all the travel protocols that have been put in place for travelers to ensure that they do their testing before they leave their country of origin, of departure, to Nigeria, for instance. And when they arrive in Nigeria, the necessary protocols have also been put in place to ensure that they get tested on arrival, 2 days or 7 days, as may be the case for vaccinated and unvaccinated persons, as soon as they arrive in the country. We believe that with measures about vaccination from their own part, the testing that they need to do before departure and on arrival, we will be able to at least bring aside those who are possibly having the viruses, strengthen the system. And for us as Nigerians also, one thing we'll also appeal is that this is not a time to continue the mass gatherings. I know there is temptation for Nigerians to be involved in festivities and all that in times like this. But we say that if that has to happen at all, let it be something that is done outdoors, where there will be good ventilation. And also, we are not going to lose guard as respect to the request and the appeal for us to keep masking, to keep wearing our mask as much as possible, because the beauty of this whole interaction is that the same preventive measures are still very effective as long as we keep putting them to use. We still need to continue to wear our mask, even in those gatherings, if we have to gather outside, for instance, but definitely not indoor. One thing we have seen also with the Nigerians is that people just put the sign at the entrance of the event center, no face mask, no entry. But as soon as they enter, they remove the mask. The risk is actually inside. Not even much of them is higher inside, not even the outside that they are coming compared to outside.
I think
rather.
it's important
So
to keep making that point, really, because, we see that happen a lot. And you wonder, is the infection also staying outside? But, we need to reiterate those points you have made. But I'd just like to also clear an issue which we've seen past few days. We've seen backlogs. 2 days ago, there were a backlog of 8 deaths from Edo. Yesterday, backlog, I think 10 from the same state. And for a lot of people looking at the figures and wondering just what is responsible for that, as we wind down on this, can you just elucidate on that? Why is that so?
All right. So it has to do with the logistics with reporting across the states. The NCDC only reports data that are verified by the states and sent to us. And within the time of collecting their data and sending to us, some may not be reported real time. And because we have a time set to collect all data across the country, and we need to reach out to Nigerians to give them the daily update, if there is any delay in sending the reports to the national database by the states due to one logistic reason or the other on their side, then it becomes difficult for us to put such report in the report for that day. And we will not be fair to add it to the next day. So it would be appropriate to say this was meant to be for 2 days ago or 3 days ago, but because of whatever delays, it got to be reported now, and that is why we say backlog. But we are improving efforts on this to ensure that we have improvement on our electronic data transmission processes so that this data can be reported real time, and we are sure that over time we're going to get out of this. And as we tidy this up, it's important to let Nigerians know that as we go into the festive season, please, it is not a time for us to be afraid. Right. We can still continue to do our activities, but we need to stay safe and stay protected. Maybe use this opportunity to tell Nigerians NCDC is committed to protecting the health of all Nigerians. Right. And we do this within our mandate to protect, to prevent, to detect, and respond to public health emergencies. We are not a fund distribution organization. We don't give palliative. People have been sending messages saying from NCDC, please let's desist from such. Let's ignore such messages. We continue to protect our health, doing evidence-based interventions to get Nigerians protected.
Well, Mr. Biodo Oguni, that's a great place to anchor. Thank you so much for sharing your thoughts. Mr. Biodo Oguni is the head infection prevention and control at the NCDC, joining us from our Abuja studio. Thank you.
Thank you very much, Kayode. Thank you, Chinese, for all you do.